Okay.
Hey, got it fixed. Right. Everybody wanna do what you. Mhm.
Welcome to the show, Dr. Patton. How are you doing?
All right, good sir. How you doing today?
Doing well, doing well. Glad to have you on with us today. And also, like I said, Dr. Patton, could you just tell us a little bit about yourself? You are currently the over the community outreach, right, for Norton Hospital?
Yes, sir. Recently, I'm now the medical director of community outreach. I am a family medicine physician
Okay.
practicing in Norton in the Preston area, and I'm very honored to be here today to talk with you.
Well, great. Thank you so much for being here with us. And now I have a I haven't seen this person's face in years. And we went to high school together. And I'm sure her family are really, really special. And I remembered her as Angela Booth, but now it is Dr. Angela Booth Jones. Angela, welcome to the show tonight. Good to have you with us.
It's good to be here. Thank you so much for inviting me.
Thank you for being on. And Angela, you are an epidemiologist. Am I correct?
Yes, that is.
And who are you? Where do you currently work? What do you do? What's your specialization?
Yeah, I work in Columbus, Ohio, at a hospital system here. And I have been doing infectious disease epidemiology for the last 20 years. With that, I lead the infection prevention program at my hospital.
Okay.
And I have basically worked with a team of infectious disease docs and a team of nurses who basically drive to improve hospital quality and safety in our organization.
Well, that's awesome. That is awesome. So that's a long way from high school. So I'm going to try my co-host on here one more time. Minister Cedric, are you there?
I am here.
Okay, you're dark again.
I don't know what's going on with camera situation.
Okay.
I tell you what I'll do is I'll switch over my desktop here. I'll switch to different. For some reason, it just keeps going back. It comes back and then it goes out again. So
okay, we'll get you back on here in a minute. So, well, tonight again, we're going to be talking about the impact of COVID-19 on communities of color. This is really significant right now. As I'm sure you all, the people that are listening, I'm sure that everyone is truly aware that right now the impact of COVID-19 on communities of color has been really disproportionate. And now we're finding that access to vaccine has been equally disproportionate. Tonight we're going to talk about, the impact, and as physicians, what impact have you all seen on the Black and Brown and communities of color? I want to throw this question to Angela. What have you seen?
So I am not a physician. I'm an epidemiologist, and so my look at this is a little differently. When I look at the impact on the Black community, first I look at those things that make us as Blacks more predisposed to COVID vaccine or COVID infection. When I look at those comorbidities that exist within us,
Yes.
High blood pressure, diabetes, overweight, heart issues, all of those things influence how we are going to respond to a virus if it should hit us.
Correct.
And so when you look at those things, and then you look at our access to healthcare, and even how we respond and manage those things among us, all of those things, because we tend to ignore them a lot of times,
yes,
impact how when we do encounter the virus is going to respond and react to us. So if we have heart disease that's gone untreated and high blood pressure that has gone untreated, when we are hit with this virus, the devastating effects that it has on us is extreme.
Right.
And so what we see in most of our hospitals, and I'm not just talking about my hospital, but we see Blacks when they enter into the hospital basically succumbing and having a harder time recovering from this vaccine. I mean, from this virus.
From the virus.
And so that becomes our reality.
Right. Right. And I guess I went to my doctor yesterday, and he talked about the morbidities pieces. What is that? What are they called again?
Morbidity.
Morbidity. Yes. Because I mean, I have high blood pressure. I'm overweight. And I'm a diabetic now.
Yes.
And so he's like, you know something, you're more susceptible to this.
Yeah.
And, plus I'm vitamin D deficient.
Yeah.
And, so see, my thing is I have access to healthcare, good healthcare. And I guess that is really something that this is really exposing, is the brown and Black communities' access to not just healthcare, but good healthcare.
Absolutely.
So Angela, go ahead. Do you have something you want to say?
I was just going to say another very astounding fact is when you think about sort of Black physicians in America, I think Black physicians make up 10% of the population.
Okay.
You as an individual going to the doctor, you are more likely to trust somebody who looks like you.
Yes.
And if you don't see people that look like you, you tend to from seeking health care.
Right.
Or you're hesitant about seeking health care. And so I think that also becomes a part of the reality of what we face as Blacks. And then, like you said, access. The access is oftentimes just not there for us and for people of color. And so that becomes a part of the reality also.
Now, I guess, Steve, that's something that you're really doing with community outreach. Am I correct?
Yes, I think that both of you are definitely hitting it right on the head. We're looking at some of those social determinants that made some of those morbidities able to occur. We're looking at do we have transportation to get to our appointments? Do we have the funding? Do we have the access to insurance to cover those visits? You were saying that the representation matter. There is a study that shows that there's unspoken bias from other nationalities or ethnic groups that treat people of color or other brown skin. So those are some things that can definitely highlight why the COVID virus has taken such an effect. I mean, we think about it's 13% of the population of U.S. population is African American, and when I was initially looking at the studies, that was over 20% was being affected, not only diagnosed but the death rates as well. Now, recently the rates have gone down to about 15%, but that's still we're talking about out of 13% of the population, and that those things as Dr. Jones, or you prefer Dr. Booth or Jones?
It doesn't matter. Dr. Jones, Dr. Jones.
That she was touching on that obesity, hypertension, and diabetes allows that number, that percentage to be greater than what it should be, as you were saying, disproportionate to what we're looking at. And I'm glad we're able to have the discussion, and I'm glad we're able to, it's on the table now. We can't deny the facts anymore.
Yeah. Absolutely. And I guess that's the part that I really want to hammer home today. We can't, this is exposed a lot. COVID has really exposed a lot within the United States as far as health disparities. But I guess I really want to try to let's really get into this. But why has there been such hesitancy in the Black community to really a lot of time to go get tested, or even with the vaccine right now, what is, why is there such a hesitancy? Could you, I'm going to throw that to Steve.
Yes, there's a lot of things in history which is a warranted hesitancy. I think we need to first give acknowledgement that what people are feeling is a legitimate concern,
Yes.
and then we can go over some of those things in the past. Generally, in the U.S., there has been a history of more so doing things without consent or fully informed information, which would allow people to choose. I know a popular one because it is dealing with some review which has been going on recently, like the Tuskegee experiment,
Yes.
or the studies where people were, let's say, sterilized without their knowing, or the studies even before then with experimentation before the ethical code was put in place, where we were denying pain medication and kind of seeing what made the body work. So these tests that were going on, that was going on for many years, like the Tuskegee experiment, that ended around in the 1970s.
Right.
How long ago was that? That's kind of recent, right? A 40-year-old study, and that's kind of recent.
We were born.
Right.
Yeah. So, and then we think about the culture. Normally, our elders are the ones who passing on that history to us, and a lot of the times we don't question as much. They say, "Hey, don't do this." Okay, we're not going to do that. That's just the way things are, necessarily in a different mind frame. So when we have people and heritage that have been spreading our word along, which is kind of more of a historical thing before, because our history books were burned down, right? We weren't allowed to pass it on. So a lot of it was word of mouth, which is still occurring now. So when we have these worries and concerns, that's a lot of word of mouth. And also, and to add on to everything else, this is new technology, a new vaccine that people are unfamiliar with. And then there's so much going on now that we have social media that can definitely influence those people. We have those people that are actively giving out misinformation to scare the people. People are doing things for clickbait. And we're also, the population in ourselves, we aren't as attention focused as some would like. I believe a lot of times it's that one header, one sentence that people review instead of digging into the article and reviewing themselves. Sometimes we can somehow be misled. So I think there is a variable of factors that's affecting the mistrust in the community. Even a recent survey says only 42% or so of Blacks are willing to get the vaccine right now, where 60% of the white counterparts were agreeable to get this vaccine. And I think that's just some proof in the pudding that, things have been going on. Yeah.
Okay. Angie, do you have something you want to add to that?
No, I was just going to say, I think you hit everything that I would have said. If anybody needs to understand sort of what has happened to us as part of the things that have formed our fears, our hesitation about trusting science, it is all of those things that Dr. Patton has talked about. The reality of our bodies being used at the sacrifice of medicine is very, very evident.
Yes.
Even to the extent of our corpses, our slave bodies being taken out of the grave and being used in medical schools across the country.
Right.
That is very impactful.
Yes.
When you take all of those things and you ask us to trust something, how can we trust it when we've seen all of this happening around us?
Right.
And our ancestors were taught to keep a quiet lip about it.
Yes.
And not to speak it.
Yeah, right.
Because there were too many people in positions of power that controlled their economics.
Yeah.
And that became the reality.
Wow.
But I ask us to think about sort of where we are with this vaccine. And to think about the young woman, African-American woman, who played a role in the creation of this vaccine.
Yeah.
And if you think about that and the trust that should be with that, and all of us on this platform right now, that becomes our new reality.
Right.
And that should be the things that we focus on, but not ignoring the things of the past.
Right.
Because the things of the past help shape and form us.
Right.
And I think it gives us all a voice to want to carry things further so that we do continue to advance our people.
Okay, well now I want to pull, you said something that was very significant. I don't want to brush over that. You mentioned an African-American woman. Could you talk a little bit about that? So, because we're trying to help people, educate people to the point where they, you know something, I've got to change the way I think. I've got to change so I can protect me, my household, and my people. So could you please talk about that, please, a little bit?
Yes. So Kamika Corbett, I believe is her name. And she's Dr. Kamika Corbett.
Right.
She basically worked at Moderna as they were creating this vaccine. And so when Dr. Fauci is visiting the plant where this vaccine is being produced, he encounters her. And the reality is, if she didn't speak up and say something, it might have continued to go ignored.
Wow.
Because the reality is she's standing there in the midst of everyone else. And she's the only one that looks like us.
Yeah.
Wow.
And he gave her credit. Dr. Fauci gave her credit for her work and the work of her team in creating this vaccine.
Now, okay, I want everybody to get this, because this show is broadcast from coast to coast. I want everybody to really, really understand what you just said. There's a person of color that is very vital in the development of this vaccine.
Yes.
Okay. So if you didn't know, and you thought it was a lab of all white guys in a lab that were making up something, they were going to try to put a microchip in to try to track wherever you are, all that nonsense that's been all out on the internet. I want you to hear this again. If it wasn't for a Black female who's a doctor, who works for Moderna, her development, we would not have this vaccine that we have.
She was very instrumental.
Very instrumental in that. Cedric, what do you got? You have something you want to say, Cedric?
I'm taking it all in. I'm taking it all in. I don't have much to add to that. I mean, I think our distinguished guests have covered every base.
Yeah, that right there alone is something that you don't know, that we didn't even know, that the public needs to know, especially the communities of color, so they know that there's somebody that looks like us that developed this, that developed the vaccine that's going to help protect us from a very deadly virus. Wow. You just really just blew my mind with that. That's something right there. I didn't even know. So I guess, okay, when we're looking at the vaccine, let's look at the vaccine. Okay. Some of the side effects of the vaccine. A lot of people are really concerned about that. Before we even came on the show, I started getting questions from people for you all. They didn't want to miss the show, but if they did, they wanted to make sure they had. This vaccine, again, it was developed really quickly, but it was also developed under a guise of leadership that was not trusted within the United States.
Can we talk about the development?
Yes, sure.
In the mindset of us as the consumers,
Go ahead.
we see this as happening rapidly. The reality is these vaccines have been sort of in the making since the late 1980s. So they've been producing vaccines similar to this and working on these vaccines in animal models and whatnot, and all kinds of infectious diseases. So that's been going on for a while.
Okay.
Right.
The cost of producing a vaccine is extremely expensive. And so when you think about a vaccine and a production process, there are 3 different sort of methods that are typically used.
Good. Teach us, Angie. Teach us, please.
So there's the protein method, there's the vector method, and then there's the mRNA method, which is what we are seeing.
Right.
The mRNA vaccine that we are seeing in production right now with the Pfizer and the Moderna vaccine, that is a vaccine that is being used because, for one, it is safe, it is efficacious, and it is easy to mass produce.
Okay, do me a favor. Okay, that word efficacious, that's the one I really want our people to get. Could you please talk about that, what that means?
So efficacious means that the vaccine is going to do what the vaccine sets out to do.
Okay.
So the vaccine is meant to protect you against the COVID virus. That is what this vaccine does. So that's the effectiveness of the vaccine. It is mass produced because it has already proven to be effective in animal models or in the cell.
Right.
The other word that I think gets tossed around a lot is this word called efficacy.
Yes.
Effectiveness is different from efficacy.
Okay.
Effectiveness says the vaccine is going to do what the vaccine is intended to do.
Okay.
Efficacy says the vaccine is going to prevent individuals who take the vaccine from advancing into either death or serious disease as a result of COVID.
Okay.
So when we look at the Moderna vaccine and the Pfizer vaccine, and we hear that they have an efficacy of 90 or 95%, that is telling us that that vaccine is basically going to prevent 90% of the people who get it from either getting severe COVID disease or death.
Okay. See, that was never explained before like that. It needs to be broken down into layman's terms.
Plain old English.
Because when you hear everybody's like, oh, it means it's 95% effective to keep me from getting COVID.
No.
That's what people think. What you're saying is it's keeping people from developing symptoms and progressing. Is that what you're saying?
It's keeping you from getting severe disease, hospitalization, and death. That's what it's measuring. That is efficacy.
Okay. Great. Okay. Thank you. Steve, you got anything you want to add to that?
Yes. I think Dr. Booth hit everything right on the head as far as the process. I know that another thing that people are concerned about, not only how it was made, but why that timeline was able to be done so quickly and effective in itself. And I think that to break the process down in that regard, as far as time, how was that possible? First, normally in a disease state, we have to track down what's causing the disease. Then once we find that out, we have to figure out whatever that is or that virus. How does that virus work and attack the host? And then then there's still a lot of red tape. There's going to be different companies at competition. They're not talking to each other and see which can come out with one first, and then will it be approved by the FDA? It's going to take months before they even approve it. But during this case, it was a special case that so many deaths were occurring that we got rid of all that tape. And not only that, researchers from China said, hey, here's the virus. This is how it works. And this is the tool that it's using. So we were already months and years ahead of things right there. And then not only that, the government said, we're going to pour in millions and billions of dollars. So it's not per se on that company to take a risk of developing something and then they lose their money. No, they're being funded for this. So that's speeding up the process. And now we're talking about worldwide. We are all communicating and talking. So hey, this didn't work, but this one did work. So we're all sharing each other's notes. So it's an open book test with the world. So that was able to speed up the process a lot quicker than normal processes, which is another concern about people. Like, why did it happen so long? So not only the way it happened, but why it happened so quick is another concern for people. And then as far as the side effects of the vaccine, like she was saying, how efficient and effective it is, right? That's one critical component. Then the other one is it causing death? I think we also all end up comparing the vaccine side effects to our normal day of life. We don't compare the vaccine side effects to the COVID virus, right? So what happens there they're gonna say, "Oh man, I don't like these headaches. I heard you feel like the flu for a couple of days, the body aches. I don't want that either compared to how I'm feeling now. I'm feeling okay." Now I say you're gonna have some body aches and some headaches for a couple of days, and then versus you die, you have chronic respiratory scarring, possible strokes, or inflammation of your blood vessels. And I say, okay, that's a different perspective. I understand, but also something else you want to think about is most of the effects or the side effects that we have of the vaccine is saying, hey, the vaccine is doing its job. If we get the vaccine, our body is mounting an immune response. It's setting up an alert. And that's how we get some of those symptoms. As a fever, it increases the cell's ability to fight off virus better. So a lot of that time is an alert. The body is already setting up a defense. And then we think about the second shot. Normally you hear, oh, I had a sore arm, because that's an immune response around that injection site. That second shot, normally you hear you're getting worse side effects. And I have patients coming in like, I don't know. I heard my son, he was doing great. And next thing you know, he was down for a couple of days. I'm a little worried about it. No, the vaccine is not at that immune response. So when it was exposed again, guess what? The troops are ready. So most of the time, you're going to have an even quicker, more abrupt what they call the side effects, right? That muscle aches, feeling fatigue, the headache, those flu-like symptoms, because the immune system doing its job. So it's saying if you got the virus, that immune system is about to swarm on it, right? So those are things you want to consider when you're talking about side effects. And then I can also get into the other things that appear to be a little scarier.
We don't want to scare people away on that. We want to make sure that we get people out there to get vaccinated.
Here's the other reality. Here's the other reality, Pastor Cherry.
Go ahead.
When you think about other sort of illnesses that we have wiped out because of vaccines.
Right.
Yeah.
Think about that. Polio. We don't have any polio.
Yeah, we don't.
That was a vaccine.
Yeah.
Measles, mumps, and rubella.
Right.
Yeah.
We have very few cases of that.
Right.
And guess what? It requires 2 shots.
Yeah, yeah.
And we have to get those 2 shots in order to have it be what it is.
Wow. You guys are educated. That's education. These are the things that you don't hear, that we're trying to get. That's what the purpose of this show is, to get these things out. Now, we're on multiple platforms, guys. So we're getting questions on another platform that we're on. And one of the questions is there truth that the vaccine could cause infertility?
I have not seen that anywhere.
Okay. Steve, have you heard about that?
So I can't name the specific receptor site, but they were concerned that the vaccine can get on a specific receptor site that would alter the fertility in women. And I would have to get more detail into that, because it's not true. So I didn't go into it as far, but the general premise was that the vaccine can do that. The thing is, the COVID-19 virus will have those same receptors. So is it true for people who've been infected with the COVID-19 virus that they're going to be infertile as well? It hasn't been enough data to correlate that as well. So I would say that is not true.
Okay. Well, that's good to know. And I have another question. What are the risks with having multiple allergies? Because this viewer has said that she's been trying to get the answers. She went to her own doctor. He couldn't tell her. I mean, and nobody could give her anything on this.
My opinion in regards to that is, unless you're allergic to a component in the vaccine, then there is no cause or no concern for you taking this vaccine. Okay.
But how do you know if you're allergic?
Contraindication that they list for the COVID vaccine.
Go ahead, Cedric.
No, I was just going to say, how do you know if you're allergic to something in the vaccine?
You can look at the vaccine components. The vaccine components are listed. Like if you were to go to whatever vaccine you're taking,
Yes.
they list the active ingredients and the inactive ingredients in every vaccine that is out there.
Okay.
And you can go to it and look at the minute detail of those components.
So when I go take the shot, then do they have you fill out a form that, like, a list of your allergies, and then the doctors look at it and say, okay, you're allergic to.
Yeah,
okay, I was just curious. I haven't had the shot.
Yeah, you would do that. Yeah, you would do that. And as a part of taking the vaccine, any reputable place that you go to get the vaccine should have you monitored for 15 to 30 minutes after the vaccine.
Okay. Okay.
So basically, I want to make sure everybody gets this. So what you're saying is that when you go, they'll have they should have something like you said, like almost like a list,
a survey form.
A survey form of like what you're allergic to.
Yeah.
If you're allergic to anything in here, then you may want to not take this one.
Yes.
Okay. Because I want to make sure people get that.
Yeah, I have seen people go so far that have allergies that still take this vaccine, and they'll bring their EpiPen with them just as a precaution.
Okay.
And I have seen very few of them have to use their EpiPen, but they will have it with them just as a precaution.
Okay, good. Okay, that's what I was wanting to make sure that everybody gets that too. Because I mean, we have a lot.
I gotta ask. When you finish there, Pastor Terry, I got a question I want to ask.
Go ahead.
I'm Mr. Simplicity. So on our fear factor, as a people, as a cultural people, because sometimes I hate to say it, we're a little bit lazy. We don't take the time to get out and read. My fear factor of having this virus is what? Scale of 1 to 10, 10 being high, 1 being low. What do you think I should be worried about? The average citizen I should be worried about?
I would say that the reality for most of us is there's a lot of us that get active infection. Okay. There's a lot of us who have the virus but don't show any signs or symptoms. They are what we call our asymptomatic carriers.
Yes.
So you who get the disease, if you were to get infected, you could very easily transmit that to someone else, and someone else can easily transmit it to you. So when you talk about this concept of spread, if I have the flu and I'm around other people, I can easily give the flu. Just me having it can easily give it to 1.3 people very easily.
Wow.
With COVID, if I have it, and even if I don't know I have it, I can unknowingly give it to 2 to 3 people.
Wow.
Wow.
So if you think about how quickly it is spreading, that is why we have the numbers that we have right now.
Right. Okay. So my fear factor should be little to none. I should go get the virus.
If you have
the
getting the flu, you should double your fear factor for COVID.
Okay. I don't ever get a flu shot no more. I quit.
You should double your fear
factor.
I got you. I need to be up in there. Okay. No, I like to keep it simple like that because a lot of people, as I said before, a lot of times we as Dr. Patton said earlier, you know, we're used to things being passed down by word of mouth. So we're picking up a whole bunch of books, and so we definitely need to hear it. You know, you don't really have a lot to be afraid of, Cedric. So man, go get the vaccine.
And here's the other part. For a lot of us who are shying away from COVID and the COVID vaccine, we should at least do ourselves a favor by getting the flu vaccine.
Yes.
Because that vaccine
that's got me out now. Okay. All right. I'm gonna have to break out my PhD in a minute, Dr. LaBooth Jones. My player hate degree about to go into effect.
You don't know Angie like I know Angie. Angie will call you out.
Well, I'll find it out.
That's what we need to have.
Right. It's a very frank conversation.
Absolutely. Because like I use myself for instance, like I had an accident March of last year and I had to take all these medications. And so I don't know how my medications are going to react to this vaccine. You know what I mean? And when I go and see my doctors, my neurologists, and all these other doctors I go see, right, so-called specialists, they can't tell me nothing. Like, I don't know. I mean, you should just be lucky you can do what you do. It just doesn't make sense to me. So that amps my whole hesitation, is because nobody can really tell me how my body's going to react. And I know I just want a decent amount of certainty that I'm not gonna walk outside 35 minutes later and have a seizure at my car and be up and out of here. You know what I mean?
Right.
So
and most of the reactions that follow the COVID vaccine, and within, if they're going to happen, they happen within 30 minutes.
Okay.
And I would like to just touch on a couple other things real quick. As far as the side effects go, we were talking about those muscle aches and fevers, and if you can tolerate those side effects, I would say tolerate them, because what they say, you practice like you play. If you're gonna practice hard, then you'll play better. Same thing with the immune system. So Tylenol and ibuprofen can kind of downplay your immune system if you take those. So then it's not practicing how you playing, right? You practice at 50%. That's how you're gonna get, right?
Yeah.
So some are saying if you can withhold the symptoms, if it's not too bad. Now I'll tell you, I'll be honest. I took 1,000 milligrams of Tylenol. I tried to stay away from it after this, but the second shot and that headache, I said, okay, I'm not functioning and I still got some patience to see. I'm gonna go ahead and take the Tylenol. But if you can tolerate that, try not to. And my preference will be Tylenol over ibuprofen or any other NSAID, a non-steroid or anti-inflammatory, because those play a little more role in downing the immune system than a Tylenol would.
Okay.
So that's one thing. And then the other thing is, you guys definitely should get your flu vaccine as well. But I would say with any vaccination, it's going to be right now, because of based off the studies, they want it to. I believe if you go to most centers, they're going to tell you they want to wait at least 2 weeks before they allow you to get the COVID vaccination. So, and that's just kind of to replicate the initial study, since people weren't getting vaccinated when they got the vaccine. They want to try to keep that as close as possible. Right. So just in case, if you're like, okay, well, I may want to hold back on my flu shot right now because I'm going to get the COVID vaccine, but then I'm going to come back to do it later. I just want you to be well informed of that.
Right.
Okay.
The other reality for the COVID vaccine too, if you're making a decision regarding flu versus COVID, the availability of the COVID vaccine is slim. Right. So when they present to you, this is your window to take the COVID vaccine, take advantage of that window.
Okay. I want to say this because I want to get into that, Angie. Hold on for a second. If anybody has any questions, please go to the comment box, put them there, whatever platform that you're on, we'll get to them. And we want to make sure that they get your questions answered, because we don't want you leaving here ignorant. We want you to know exactly what this whole vaccine piece is about, what you need to do, how you need to prepare, all that good stuff. So if you have any questions, please put those in the comment box. Know that we're on multiple platforms. So also, please click like and share. We want as many people to see this as possible from coast to coast. So please, ma'am, please, sir, click like and share. And share this with your group of friends as well. So I have a question then, since we're talking about all this good stuff here. We've been hearing about this herd immunity. What is that? Could you please bring some plain English to this? What is herd immunity, Angie?
Okay, so when there is a disease circulating, the disease spreads and continues to spread until enough people develop immunity to the disease.
Okay.
So when we are looking at something like COVID, COVID continues to spread and spread and spread, and you'll have individuals within the population who will have had the disease. So that is called natural immunity.
Okay.
And then you'll have people in the population who has vaccine-induced immunity.
Okay.
So the combination of those two things, once you get enough of individuals, that herds of people protect the others from getting the disease. So the disease basically stops spreading as quickly. So for COVID, the herd immunity that we're trying to get to is about 70 to 80%.
Of the population.
Of the population either has natural immunity or has vaccine-induced immunity. And if we can get to 70%, we will slow down the spread of COVID.
Where are we right about now? Do you know?
Oh gosh, I would say we're probably, and this is not just the United States. We have to get to this point worldwide. Because this virus is being spread across continents.
Yeah, and like Dr. Jones was saying as well, like you were saying, where are we now? I think we're about at 40 million vaccinated total. The population of United States alone is like 320 million. So that kind of gives you an idea of where we at. I don't know, it's like 12 or 13% or something like that. I'm not sure, but I know that's how many is vaccinated up to date. So in another sense of this, break it down to you. If I'm surrounded, if I'm unvaccinated and I'm surrounded by 10 vaccinated people, it's very rare that I'm going to get it. And the other way around, nothing's 100%. So if I'm vaccinated with 95% efficacy, that's 5%, right? So if I surround myself with 10 people who aren't vaccinated and have the virus, and I go in there vaccinated, it's still a chance I can get the virus at the same time, right? So you want to think about that. Even though those both studies have showed a significant decrease in how effective and efficacious they were at preventing that, especially the serious or severe illness from getting that. But that's kind of the idea of herd immunity.
And that is why we also still have to wear masks even after we get our vaccine, because there's still the potential that it can spread.
There you go. There you go. Continue until otherwise told. Continue to wear your mask. I'm gonna say that one more time. Continue to wear your mask. 6 feet. Come on, social
hand washing.
Yes, and understand. I'm a pastor, and I would love to be able to. I'm not criticizing anybody. I would love to be able to go back to in-person worship. But with my comorbidities, along with trying to think about everybody else in the congregation, their comorbidities and all that good old stuff, that's too risky. And like in what you're just saying, when you look at that whole thing, I'm one person, and if I go and there's 10 people that might be, you want to reduce that risk. And I know, and I guess, and I'm speaking to my pastor friends today, right now. Let's be smart. God gave us common sense. He gave us the ability to. There's nothing more important. There should be no more important than the people that we serve, and being responsible toward them. Let's cut this in person out, and let's get this thing under control. It's not about the money, guys. The church is going to be here. The very gates of hell will not prevail against it.
And can I spell one more thing about herd immunity? Just because.
Sure, go ahead.
The nature of COVID parties, and I'm just going to say COVID parties. Super spreaders. Don't do those events. Right. It is absolute ludicrous and nonsense. Right. The reality is we did those things, and I'm dating myself, Pastor Corey. We did those things when my kids were being raised, and the neighbor had chicken pox. We gathered everybody at the neighbor's house so that everybody could get chicken pox.
Everybody,
really? We did that foolishness.
Yeah, we ain't do that in Texas.
We did that in Kentucky.
We did that in Kentucky.
That's what we did. My mom would say, "Go down the street and play. Go next door." Exactly. We ain't had the chicken pox yet
because we wanted to make chicken pox spread. We did that.
Get on out the way, huh?
We don't want to do that because chicken pox is something that even if we spread it, we have a certain amount of control.
Right.
Gotcha.
COVID, if we were all in a room, my body is going to react to COVID differently than somebody else's body.
Correct.
And so it is not wise to have COVID parties.
Right.
And I'm hearing way too many young people talk about COVID parties.
Yes.
Yeah.
Yeah.
The craziness of that.
Yes.
It is absolutely insane.
Right.
So what do you think about people traveling right now? I'm wearing my mask. I'm going to Miami.
Yeah.
What do you think about people doing that?
I think you are easily putting yourself at risk because you're now changing your environment.
Mm-hmm. I agree with you. And I think we should stay at home.
And I know people are, we're all tired. We all want to get back to life what it was back 12 months ago.
Mm-hmm.
We want to get back to that. But we got to do it slowly. We got to take our time.
Yeah.
That's right.
We got to allow the science to work.
Yeah.
Right. I'm one of those people. I'm enjoying this. I'm gonna be honest, man. I don't have to worry about people showing up. I ain't gotta worry about nobody inviting me any place. So I'm truly enjoying this, and I try to encourage people. Man, pick up a good book. Go park yourself on your back porch where it's just you and your book, and just enjoy yourself. Go sit at the kitchen, learn a new trade. I'm learning how to cook. I'm teaching myself, but I'm learning how to cook. I'm keeping myself busy, and I point that out to say this, man. I truly mean this. I'm coming from a serious point. That lack of knowledge thing. I try to tell people, look, let's take this time that we have apart and let's learn something new. Become better at what you do. I work in the IT field. So what can I do? I can start back reading books, right? I can start back studying different protocols. Go do something productive. It doesn't, other than spreading COVID-19 to everybody you meet. So I don't know. That's my little tidbit of wisdom from this. I'll be quiet.
I agree with you. We should definitely stay at home, but I also want to acknowledge those people. Same thing, we need acknowledgement about our past and why we have hesitancy. We need to acknowledge why people are having this COVID fatigue. This virus has not only been detrimental to health, but it has been detrimental to economics. People are losing their jobs, depression, increased risk and intake in alcoholism and domestic abuse. Kids are stuck out of school, pressed, and this NTI, new technology is put in place, and lack of childcare and ways to get out and do what they normally have been able to do. And on top of that, on top of the chronic disease, people are afraid to come into their doctors. I see a lot of train wrecks come in because they've been avoiding it, and they're robbing Peter to pay Paul. So there's so many different variables that it can be a breaking point. You can't see your family for the holiday. Maybe that was the only chance you got to unwind. So a lot of people are in that situation. So it's understandable to have this fatigue, but it's also necessary to get this knowledge of why it's important to maintain.
Absolutely.
Right. I want to throw this out. What can community leaders, churches, civic groups, what can we do to help educate or to help bring an awareness to our communities?
I think examples of what you're doing right now.
Okay.
Exactly. Yes, sir.
It's so essential. And it is just, we all just matter. And look at the conversation we're having.
Right.
We're having open dialogue about something that is extremely critical to our population right now.
Right now. Yeah.
And this is what we need.
Right.
And we need to continue to expand this.
Right. Right. And I guess my again, as a pastor myself, I didn't want to have to get on the soapbox, but it just really just disturbs me when I see other congregations gathering, and it just really disturbs me. Now, mind you, again, you can do whatever you want to do with your own church, but let's be responsible.
Yes.
Yeah. When I say responsible, I get it. You're going to have hand sanitizer. You're going to have people going back and forth to the bathroom, clean the bathrooms out. You're going to have all these different things. Going to have people 6 feet, but still, that's no guarantee that the people will be safe.
Right.
Be safe. Go home. Virtual. And I guess those are the things that I really just really touch me, and that really bothers me when I see our people. We're willing to to go to a building to worship, but when reality we're the church. So wherever we go, you know what I'm saying?
Yes.
So if I'm at home, I'm the church.
Mm-hmm.
I'm the church. So I'm just it just really just that really just gets me. So I do. Let's keep on going because we got about 5 minutes and then we're going to be wrapping up here. Let's see here. We've talked about hesitancy. We've talked about, but okay. You remember we talked earlier about education, right? Educating ourselves. Where are some places where our people can go to educate themselves? Because check this out. When you go to some sites, they're so techy. Mm-hmm. Only people like Dr. Jones and Dr. Patton will understand them. But where can our people go to become educated or to educate themselves on COVID, but also the vaccines?
My first source of truth that I think people should just get used to going to is cdc.gov.
Yeah. Okay.
And CDC does a really good job of presenting things to us as health professionals, mm-hmm. but also our community.
Okay.
That would be my first place to go.
Okay, and I'm glad that you said cdc.gov. I really want to. We got to dispel some things first when you talk about that, because under the previous, I'm not here to pick sides, but under the previous administration, the CDC has been tarnished. Mm-hmm. Because of some of the things that were allowed to happen. Mm-hmm. How can we reassure our people that this is still a solid place to go for information?
I think, well, first off, look at the new director for CDC.
Okay.
As a start. Okay. She's made herself available.
Yes, she has.
She's really made herself available in to all communities. Okay. So she's definitely a trusted resource.
Okay.
And I think when you look at sort of the number of African Americans that even work for CDC.
Okay.
That also speaks volumes.
Right. Okay.
It truly is a source of truth for us. Okay. And there are lots of things that are done in medicine and in healthcare that stem from guidelines and recommendations from the CDC. Okay.
Okay. So CDC. Mm-hmm. Where else, Steve?
That's a definitely go-to is the CDC. That has they have question and answer sections, live data. I think that's definitely a go-to. One thing that I would just give someone advice on when they're taking in this data, because there's going to be so much stuff that's going to come at people, so many articles. I want people to consider this. When we hear these claims of something, so let's say, just know that things are going to occur in the population regardless. I remember we used this, people were saying, well, they're escalating the counts for COVID because these natural deaths were going to occur anyway, right? And then, but you have to look at, well, how many deaths was it last year compared to the additional deaths with the COVID virus, right? Mm-hmm. But we don't use that same perspective when we think about rare side effects that can occur. Mm-hmm. Like, well, this person had a weakness on the left side of their face after the vaccination. Can you correlate that to the vaccination? Because cases of that can occur about 40,000 cases in a year, right? So some cases of things were automatically going to happen without known cause beforehand. So then they have to say, has there been an increased amount of those cases with the vaccine, which results have not shown that to be the case off of the original studies. But remember, when we start getting out into the wild, I call it, versus the controlled, we're talking about 40 million people. So 40 million people, can something strange happen? I mean, I remember that happened with like measles and mumps. They said, oh, a case of autism happened after they got the vaccination.
Right.
And they try to correlate that. Like, whoa, that could have happened regardless. And then the research later on found out that's not true. It's not correlation.
Right.
And so you want to keep that in mind too. So a lot of the times we see those one-headers that say, man, healthy, and low platelet count afterwards. Okay, those definitely deserve to be worked up and make sure there isn't a cause, but we have to keep in mind that, hey, these things could already be occurring beforehand. So just keep that in the back of your mind regardless, and then check CDC.
Yeah, but see, Steve, I like the way, I'm glad that you explained that way, because I believe that's been a lot of misguided information put out there.
It has.
It really has, and it's really affected people's ability or people's willingness to go and to get this shot. Now, here's this is really bothering me, because I had this conversation with someone today who was white, and we all know currently you have like 1A groups, 1B. My mom, I think she's in 1B. She's 85 years old. To be able to go take your shot. I just found out today from someone that she has had her shot. And I'm sitting here, okay, how did you get yours? And she went on to tell me, well, I have a friend that's on the inside, and she was able to get me, my mom, my dad, my sister, and all these other people in to get their shots.
And that's not right. That's
not right.
No.
That's not right. But it's also sends a message to communities of color that if you don't got in, like I got in, you're not going to get your shot until way down the road.
It's not what you know, it's who you know, and that's not fair.
That's not fair.
And there's a lot of leaders, even within healthcare, who could have gotten their vaccine sooner, but chose to go when it was their category or their turn.
Right.
And me as an individual, I have greater respect for those that wait until it is their turn. The other reality is there are lots of people that are able to get their vaccine because they are on a wait list.
Right.
And wait lists are created so that vaccine doesn't get wasted.
Right.
You don't want vaccine to get wasted. And so once you open up a valve and start to use the vaccine, and you have basically filled the appointments for the day, and you have a vaccine valve still there, and you got 6 people that could still benefit, you want to be able to use that content. And so you might call individuals off of a wait list. So I understand if those people get ahead of their category.
Right.
But for people who just because of who they know, that's not right.
Right. And so I guess the thing is, again, we really want to make sure, and I have this one more thing. Could you guys talk about your experience? Because your experience, you both have had the shots. I've seen both of you. What has your experience been like? And what can in any things that you would suggest to our listeners right now that they can do to make their process much easier or better? Could you all just share your experience? I'll let ladies go first. Angie.
Okay. I had my first vaccine December 28th. I really had no issue at all with my first vaccine. I barely had arm pain, but I was very careful after getting my vaccine to use my arm to keep it moving. And I didn't want it to get stiff on me. There was nothing else that I did. On January 28th, I had my second vaccine. The second vaccine was a little bit different for me. But the effect that it had on me was really about me just feeling tired. But otherwise, I had my normal routine. I took the vaccine on a Thursday. Within 36 hours of taking my second vaccine, I was back to my complete self. And I did take an ibuprofen. I didn't take 1,000 milligrams. I took 500. A little stronger. But that was the extent of it.
Okay.
And then I made sure I drank plenty of fluids.
Okay.
After both, because I think that is very important.
Okay. Okay. Okay.
No fever or any other side effects for me.
Okay. Okay. Steve, Dr. Patton.
So with me, I got the first injection. Pretty much just had some pain in the deltoid muscle here. That hurt for about 24 hours, pretty stiff, continued to move it. Other than that, that went away in about 24 hours. And then in about the 3-week time frame, I got my second vaccination. I had a sore arm still. That pain was a little bit less. And I also had a little numbness and tingling in my fingertips. I thought that was a little strange. That went away by the end of the day. And then the next morning, I had a nagging left-sided headache. And, man, some fatigue, and it did not feel nice, I tell you. Around the 4 o'clock mark, that's when I took the Tylenol. And then by the end of the day, went to sleep, woke up, headache was gone. And from there, I haven't had any more side effects. I'm about 3 to 4 weeks out now, and feeling fine.
Okay.
Absolutely.
Okay. Now, and we're gonna say one more thing, and then we're gonna kind of wrap it up here.
Okay.
To people like Cedric, who have not had his flu or his COVID vaccine yet.
Yeah. Mm-hmm.
What advice would you give to him right now in 2 minutes? And Dr. Booth Jones.
Take your COVID vaccine.
Okay.
The reality, even in regards to your neurological concerns, I would say still take your COVID vaccine.
Okay.
And if you need further evidence, there's evidence on the National Arthritis Society's webpage.
Okay.
Talks about vaccines. And COVID vaccine might not be listed there, but it is a safe vaccine.
Okay.
Okay. Dr. Patton?
Yeah, I'll say over 400,000 deaths in the U.S. Both vaccines, 95% effective at preventing those deaths or severe side effects of the virus. It's there for you at no cost, and it sure gives you an opportunity to be a leader for your community and support those others, because they're watching you. Right now, we're watching you. So
be a leader by house. I'm the only one. No, I got you.
But to anybody, any leader.
Cedric and I'll do a follow-up show once we get ours.
Friday.
Our time comes, and we'll be able to let people know, hey, this is what we did, and this is what happened, and then here we're here, testimony, go get it done. We'll be able to do that.
Okay. No pressure. I'm gonna go sign up just because y'all saying all this.
So with that being said,
if I grow a third arm, I'm gonna have a problem.
Thank you, Dr. Angela Booth Jones. Thank you for being with us, Dr. Stephen Patton. Thank you for being with us, sharing your expertise. From me and my sidekick, Minister Cedric, we'd like to thank everyone for being with us.
Say co-host.
Our sidekick. Thank you all for joining us on So You Think with Pastor Terry, the show that is spiritually relevant, culturally significant, that encourages people to look at life issues in a non-traditional way. You can catch us at our podcast. This will be ripped into a podcast on Thursdays on Envision Radio, which is broadcast from coast to coast on Thursdays at 6 p.m. And so this is going to be a two-parter. So just join us. If you missed this, you can catch it on Thursdays at 6 p.m. on envision-radio.com. But also, thank you all so much again. And we look forward to seeing you all next week on So You Think with Pastor Terry. Hold on for a moment, please.